My name is Ishrat Jahan. I work as a research associate at the BRAC JPGSPH School of Public Health, and I was in the first Erasmus Transform PH team. We were tasked to redesign the anthropology course that we have. It's the second course in our Masters of Public Health program. I think the overall experience was very helpful in terms of not just learning how to develop a curriculum and design it, but also learn the importance of why the redevelopment is necessary. When you are working with students in a master's program, you're working with adults. It's not a one-way teaching. It has to be an interactive classroom. And I think traditionally, especially in the Bangladesh context, we have a very didactic, instructive way of teaching in the classroom, which sometimes is not effective if you want people to come out of your program not just as public health professionals, but as people who understand the community's real life context, what the ground realities are of marginalized, vulnerable people that they will mostly be working with. So it's important to have an open classroom where you help them learn from their own experiences and you put them out into field-based projects or solution-based projects that force them not just to learn a theory, but also see how that theory applies or doesn't apply to the populations they would be working with. I think the key takeaway was that redesigning a curriculum is not a linear process, and I think at the end of the day, it's a curriculum is a living thing, so it's good to approach it as something that you will constantly have to rethink and redevelop and align to not just what you need your students to learn in the classroom, but also align with what the current priorities in the public health field are. For example, with COVID, you have to now align your curriculum to teach your students how to work in a COVID context, how field work has to be approached. As a facilitator, I think this program was very helpful in terms of learning how to create an interactive classroom, because these are great buzzwords, but at the end of the day, it's really hard to break away from the way you've been taught to teach, because teachers also, we form a mold or a habit of how to teach and how to take a class, and when you get into flow, it's not easy to break away. So being conscious of giving floor to students, learning how to constantly use updated and real life examples in the classroom. I think that is a key thing that we've been trying to do as a facilitator. I think as a researcher, I would assume that I've already been applying some of these learnings to begin with, because research forces you to rethink and redevelop your approach based on the kind of data you get. But it's given me a lot of respect for people who try to approach innovative research methods, especially in the given COVID context, because constantly having to rethink and redesign something requires not just a lot of patience, but also a lot of creativity. I think this project is important because this is a unique opportunity in the context of at least the tertiary educational landscape of Bangladesh. There is an exchange of learning from universities in the north who have better resources and better structures under which they operate, and also not just to take those learnings and implement it, but also contextualize those learnings in the Bangladeshi context, and create an open learning environment that's unique to the Bangladeshi perspective. It's not just open and interactive, but it's open and interactive so that people who come into our classrooms are able to learn as public health professionals what the current Bangladeshi context is of public health. What are the gaps? What are the populations they will be working with? So that when they leave the program, they are not just capable but also empathetic individuals who go into working in the Bangladeshi public health.